If you're someone who is really looking for autonomy in the experience that you have during the year, this is really the perfect opportunity for you.
Here, the fellow is really considered a member of the executive team, and you sit at that table and you're there to learn, but you're also there to have your own experience and your own expertise heard and shared.
It was the opportunity to show up day one in an environment where I was surrounded by people who are some of the best at what they do.
MedStar Washington Hospital Center is the largest and the busiest hospital in the Washington, D.C. area.
The hospital center is seated in the middle of the city.
The amount of diversity that you can see in this hospital, the kind of complexity of cases that come here, the diversity in the patient population is something that's really remarkable.
We serve anyone and everyone. And to do that, it takes levels of expertise and professionals who are extremely good at what they do.
There are very few doors in the hospital that are closed to you, very few opportunities that are not available.
The exposure that I got here is unparalleled.
You are allowed the independence to really curate the experience that you're looking for in your fellowship. You're immersed into all levels of leadership, and you really get to be a sponge during this year.
So I started my fellowship at the Hospital Center in July of 2019, so pre-pandemic, really a front row seat in a master class of leadership where we are making decisions on the fly, where we are changing things rapidly because the information we have changes rapidly. And as the fellow, I was kind of in the middle of that. I was the person who took notes in all the meetings, organized all the follow-ups, helped be part of those conversations of how do we go forward from here, how do we communicate these changes. It was truly a privilege.
I also knew, because I had great mentors here, that MedStar Health was doing a lot of really cool things. One of those things was building out an ambulatory network. We're building buildings, we're putting care in new geographies. I wanted to be involved. I was fortunate enough to be able to join that team at an early time. The MedStar Washington Hospital Center Administrative Fellowship benefited my career very directly. I was able to take into this brand new part of the company a lot of what I had learned at the hospital.
I was coming in as an international student, looking for an experience to really understand American healthcare system and also American culture. And I really couldn't think of a better place than Washington, D.C. to come in and make my new home.
I was just fascinated immediately with D.C. I mean, I would wake up on a Saturday and go for a walk and just have to pick my jaw up off the floor.
DC is such a fun place to be a person starting out your career. For one thing, there's a ton of other people in exactly the same boat. Lots of people come to DC to start lots of different kinds of careers.
There are so many different cultures surrounding DC that you can explore and gain exposure into. It just fascinated me, and it still does.
The entire team wants you to have a great learning experience.
The nurses, the physicians, the staff, everyone here is giving it their all every minute that they're here, and that's the truth.
They are creative and passionate and really dedicated to providing great care for our community.
It's deeper than just, did I get a good job out of this? It's, did I get a life out of this?